Hi, I'm Dr. Ako. I'm a board certified family medicine physician. I'm Chief Medical Officer of Remote Medical Academy in Texas. Our presentation today is about heat exhaustion and how to avoid hospitalizations or death from heat exhaustion. What's on the agenda? Heat exhaustion, what you need to know, who's most at risk, symptoms of heat exhaustion, consequences of lack of treatment, 10 tips to help you prevent heat exhaustion, when to seek help, and action steps. What is heat exhaustion? It's a heat-related illness that occurs when your body overheats due to prolonged exposure to high temperatures, especially when combined with high humidity and strenuous physical activity. It is less severe than heat stroke, but still serious and requires prompt action. Who is most at risk for heat exhaustion? Several groups. The first being the elderly, usually older adults, 65 and older. This is because of reduced ability to regulate body temperature. And also, this group tends to have chronic conditions or takes medication that affects hydration. The second group is infants and young children because of underdeveloped thermoregulator centers in the brain, and also because this group is dependent on adults to monitor hydration and exposure. Our third group is people with chronic medical conditions such as heart disease, diabetes, chronic kidney disease, obesity, and also because this group tends to be on some medications, including diuretics and beta blockers. Athletes and outdoor workers, because of prolonged physical activity in hot environments, increased risk also in this group because of excessive sweating and fluid loss. People without access to cooling or proper air conditioning. This happens especially during heat waves. Individuals taking certain medications, such as diuretics, antihistamines, antidepressants, antipsychotics, and stimulants, all of which are known to impair heat regulation or hydration. Also, individuals who are overweight or obese, and this is because body fat acts as an insulator and leads to retention of more heat. People using alcohol or drugs, because this leads to impaired judgment and ability to notice early symptoms and take action. And also, these substances are known to reduce the body's ability to cool down. What are the symptoms of heat exhaustion? Heavy sweating, cold, pale, or clammy skin, a fast but weak pulse, dizziness or fainting, nausea or vomiting, muscle cramps, fatigue or weakness, headache. And if these symptoms go untreated, heat exhaustion usually can progress to heat stroke, which is a medical emergency. These are 10 tips to prevent heat exhaustion. Stay hydrated. Drink plenty of water and electrolytes, at least 1.5 liters daily, even if you're not thirsty. Avoid caffeinated drinks and alcohol because they contribute to dehydration. Wear lightweight, loose-fitting cotton clothes because these are best in the heat. Avoid outdoor activity during peak heat, which is typically between 10 a.m. to 4 p.m. Take scheduled breaks, rest in the shade or a cool place when outdoors. When indoors, use fans or air conditioning, especially during heat waves. Wear a hat and sunglasses to reduce direct sun exposure. Use sunscreen to prevent sunburn because this also affects body temperature control. Eat light meals because heavy meals can increase internal body heat. Check on vulnerable individuals, especially the elderly, pregnant women, and those with chronic conditions. When should we be seeking help? If symptoms of heat exhaustion don't improve within 30 minutes of cooling down and rehydrating, seek help immediately, especially if the person becomes confused, they lose consciousness, they stop sweating, they have a core body temperature over 103. Call 911 immediately because these are signs of heat stroke, which is a life-threatening condition. Thank you.